Hello and welcome to Khan Clinics, our weekly health and lifestyle show powered by American Muslim Today. In each episode, we dwell in the realms of wellness, exploring the latest trends, seek expert advice, and practical tips to help you live a happy, healthier life. Our aim is to bring a broader perspective to our American audience and discuss issues that impact your daily life by interviewing guests and experts from the US and around the world. From nutrition and fitness to mental well being and beyond, we're here to empower you with knowledge and inspiration. So, whether you're looking to boost your energy, revamp your diet, or simply trying to find a balance in your daily life, you're at the right place. Join us as we embark on this journey towards a better, brighter you. I'm your host, Dr. Amir Khan, and together, let's unlock the secret to living life to the fullest. Hello and welcome, team. I'm Dr. Amir Khan, and we're starting another episode of Khan Clinics. Today, we've got a very interesting topic. Some of a topic that you have mostly all of you come across a person or two, and seen and heard, and probably encounter someone like this. So today's topic is basically on stroke. We want to look into what are the measures one can take to prevent stroke from happening. That would be part of the discussion. But the second part really will be on, can you act promptly? Can you identify someone who is probably likely having a stroke? And then the thrust is, why is it important for you to identify that? This is not that you have to be a medical related in the medical field, but just seeing someone on the street, a loved one, or someone you're looking after, or an elderly patient, or someone. So this is what we're going to be talking about.
When someone is having a stroke, every minute counts. Just as putting out a fire quickly can stop it from spreading, treating a stroke quickly can reduce damage to the brain. If you learn how to recognize the telltale signs of a stroke, you can act quickly and save a life, maybe even your own. For both men and women, look for these 5 signs of a stroke, all of which come on suddenly. 1. Numbness or weakness in the face, arm, or leg, especially when felt on just one side of the body. 2. Confusion, including trouble speaking or understanding speech. 3. Trouble seeing, from one or both eyes. 4. Trouble walking, or problems with balance or dizziness. 5. Headache, especially a severe one that comes on suddenly. The clock begins ticking as soon as you spot the signs of a stroke, because some treatments can only be used if the patient reaches the hospital in the first 3 hours after symptoms appear. So don't wait. Call 911 right away and get the person to a hospital immediately, even if the symptoms go away. If you think someone is having a stroke, remember the word FAST. F is for face. Ask the person to smile and check whether one side of their face is drooping. A is for arms. Have the person raise both arms and see if one arm drifts downwards. S is for speech. Ask the person to repeat a short phrase and notice if their words sound slurred. And finally, T is for time. If you spot any of these signs, call 911 right away to get the person to a hospital fast. Strokes are medical emergencies. The sooner a patient gets treatment, the better their chance of a good recovery.
That was quite nice. Thank you, Jeremy, for playing that. And basically, it leads into our topic. We're going to have today, our guest is going to be Dr. Wajiha Awan Kiran. She's a medical physician a graduate of 2018 and has done her FCPS Part 1 as an advanced qualification. She's also a mother. Dr. Wajia, can you hear us?
Yes, sir, I can hear you.
How are you today?
Yes, I'm doing good.
You're doing good.
How are you?
You pick up a very interesting topic.
Yes, sir.
So, how about walking us through what we have sort of like preliminarily heard, and then we can have a discussion as we go along.
So let's start with the concept that what is stroke. I guess most of the people are familiar with this term. So stroke is basically that when there is a blockage or the bleed of the blood vessels, which either interrupts or or reduces the blood supply to the brain. And when there is decrease in the blood supply to the brain, then it results in the insufficiency of delivering of oxygen or nutrients to the brain, which then results in the brain cells to die. So, what should we do? What is the key point here? That how should we react when someone is having a stroke, or if a person himself or herself is having a stroke? So, first thing is that the signs and symptoms of the stroke are very sudden and very serious. So we should not miss those, and we should not wait to see if symptoms go away. And this is not an option at all. So we have to react immediately, because the
Gotcha.
longer the stroke will left untreated, the greater will be the potential for brain damage and long-term disability, and the person will take a long time to recover.
So, Dr. One, there is a timeline that you can give an excellent sort of therapy if you identify a type of stroke or one of the commonest types of stroke. So, it's like you were saying. So, would you mind just repeating again? Fast. F is for
Phase
identifying the
of
face. What
phase.
do you do
Yes.
in the what do you see in the face, for example? What do you identify? We said FAST. F is face. What do we see in the face?
They will be drooping or numbness on the side of the face, because we have to ask the person to smile. When they smile, then the one side of in mostly cases, one side of the face will show some drooping or some numbness.
Excellent. Or you can see the smile, there is now a tilt on it. But what about the arms, Dr. Wan? What happens?
We have to ask the person to raise both the arms, because in most of the cases there is abnormality on the one side. That's the most common type of stroke, and the person will feel weakness or numbness in one arm. So the person will be unable to raise the arm properly or could not feel.
And just a number, there's some I've had so far a lot of responses regarding rush ASAP, go to ER, but the cutoff point to give this specific clot buster is 3 hours. Hmm. It is a good window, but it gets a little complicated if things get delayed. You're out in the periphery. You realize you just found someone and you don't know how long the person was down for, and then you think the patient is having a stroke. All right. So I'm gonna let Doctor Wan continue on the one other sign that you wanna quickly ask or pick up, and that's we got the F, we got the A, which is the arms, we got the S, and that's Doctor Wan. You said it was the
Speech.
speech part. So what do you do there, Doctor?
Uh, First of all, we have to ask the person to repeat a simple phrase. Like we can ask them to repeat their name, or say it like that. My name is whatever the name is. So the person will not speak as they are used to. There will be some blabbering or mumbling voice, or they will not be able to complete the phrase properly.
Very interesting. So the if the stroke is involving the tongue or the muscles that are controlling your speech, you won't be you'll have a slur. You'll know that there is missing sentences or not making sense, and he may or may not be confused in addition as well. And then the T is the timeline, right?
Time.
So we just had a brief chat about what is the timeline. We got T to first before we could get to the S part, I guess. So please, everyone, just make a note of this FAST. This is sort of like essential, the fast part. And I know you've got a deadline. Um, some of them do extend. Okay, you've got 3 hours. Sometimes there is literature suggesting, oh, it may be extended to 4 hours, 4.5 hours, but definitely not over 6 hours or 8 hours.
Okay, so first of all, we have the stroke, which has different set of potential causes. So most common causes are when the patient is overweight, when there is obesity and the BMI is above, you can say, 30 to 35, and age factor, when the person is 55 years of age or older than that. And then there is a personal or family history of stroke, and considering the diseases, when person has hypertension, that is raised blood pressure, have diabetes, high cholesterol, heart disease, or any other vascular disease. And some things are modifiable, like these are the lifestyle conditions which may be the cause of the stroke. It is the sedentary lifestyle, and when the person is not exercising or just lying down and not active much, or just sitting in the office or not doing the exercise and stuff. So the sedentary lifestyle, and then consuming alcohol excessively, smoking, and use of the illicit drugs.
Brilliant.
So all of these are very common causes and the risk factors for the stroke.
What's the
Yes.
types? Why is the blood pressure important? Why do we have to act fast? Dr. Wan.
Okay. Yes. Let's move on to the types of stroke. We have the two most common types of the strokes, and the third one is not that much common. Let's go on with the first one. That is ischemic stroke.
Mm-hmm.
That makes up about 87% of all cases. What is basically ischemic stroke? In this, a clot forms in the
Sure.
blood, and which prevents the blood and oxygen from reaching to an area or the specific area of the brain, which as a result causes the damage of that particular area, and then the parts of the body which are controlled by the area are affected. And then moving on to the second type, that is hemorrhagic stroke. As you can also see here, there is a clot in the blood vessel, and then uh, you can see that obstruction. So the particular part of the brain will not receive the blood, and it will cause the death of the brain cells there. Next is transient ischemic attack. Some people also call this condition as a mini stroke. And why is it so? This occurs when there is a blood flow to the part of the brain is adequate for a brief period of time. Like it is not for the long time, and it is just for a short amount of time, and the symptoms resolve without any treatment because, as you can see, that there is a clot, and then it will resolve on itself after some time.
Two types we have to remember more than the third one. She's going to re-emphasize them. One is a bleeding type stroke. In simpler terms, it's called hemorrhagic, but a bleeding stroke. You've bled into the brain, part of the brain, most of the brain, some part of it, and that has resulted in a stroke. So you got to stop the bleeding. If you don't stop it, you're dead. And then the second type is where the vessel blood supply is cut off, mostly from a clot that has now occluded the blood. So there's no distal distal flow. The blood supply to the brain is cut off. So one is more blood supply, excessive blood supply, or blood supply that's been cut off. And then the second type is in which you have a obstruction of the blood flow completely. Two types. To remember that one is more flow, one is no flow. And that's why when you go in, the second part is gonna she's gonna show us a few more details on that, but then we're gonna identify why we gotta differentiate between the two, and that's a very important part. So go
Yes.
on, Dr. Wan. That's quite brilliant. So tell us first about the one that there is no blood flow. That's called ischemic stroke. In general terms, it's a ischemia. Please.
Yes. Uh, First type of stroke is ischemic stroke. And in this type of stroke, what happens that there is a some blockage or narrowing in the arteries that are particularly providing the blood supply to the brain, which then in result causes the ischemia. Ischemia means that the blood supply is not reaching there. And as a result, sometimes what happens that blood clots are often formed in the arteries which are in the brain, and sometimes it lodges from the other parts of the body to the brain. And the next type is the hemorrhagic stroke. Hemorrhagic stroke is when there is some leak or burst in the arteries that give rise to hemorrhagic strokes. Leak blood, what actually leak blood do? It puts the pressure on the brain cells and damages them. It also reduces the blood supply that can reach the brain tissue after the hemorrhage. And the blood vessels can burst and spill blood into the brain or near the surfaces of the brain. And this may also send blood into the space between the brain and the skull. And here you can see that having hypertension, experiencing physical trauma, taking blood thinning medications, and having an aneurysm can all make a blood vessel leak or burst.
Beautiful.
As you can see in the picture here, this is the artery that is supplying this part of the brain, and here is the leak. There is a burst or the rupture in the artery supplying this area, and blood is leaking out. And what happens? That blood will accumulate here in this part of the brain and will put the pressure on the other matter as well, and then the blood supply to this part will be compromised as well. Because of that, the brain cells here will die and will not receive nutrition enough to survive. Another thing that is that happens is transient ischemic attack. As you can guess with the word transient, that is, it is for the short time. So what happens in the transient ischemic attack? That is only briefly interrupt the blood flow to the brain, and they are similar to the ischemic strokes in that matter because there is sometimes a clot there, but people should treat them as a medical emergency if even if the symptoms are temporary. Because when transient ischemic attack happens, then it is a warning sign for future strokes, and it indicates that there is a partially blocked artery or clot source in the heart or the brain. It's there.
Yes. Please.
So there are the various diagnostic tests for you can see that the stroke. First of all, what the doctor will do is that physical and the neurological exams. As we have already discussed, be fast. This also includes the physical and the neurological symptoms, neurological examinations. Okay, and the second thing is CT scan. In CT scan, basically, this is a scan of the brain in which all the parts of the brain will be visible, and we
Sure.
can see that is there any blockage or
Mm.
because ischemia is available on the CT scan, and then there will be MRI and carotid ultrasound and also the blood test.
Blood
As
tests.
we have already discussed that we have to detect early for the better production.
What would you do for the hemorrhagic stroke, and what do you do for the non-hemorrhagic stroke, the bleeding stroke, or the one that says no blood flow?
Ischemic stroke, we can have the drug options like aspirin, and then intravenous injections like TPA. TPA is tissue plasminogen activator, and then delivering the medications directly to the brain
Perfect.
and mechanically removing the clot.
So,
What
Dr. Awan,
everything?
that is your clot buster. That
Yes.
is the TPA is the medication that you wanna give within 3 hours. It doesn't, then the medication doesn't work. The number two that is there is the one that we wanna get in as soon as the possible if there is no blood flow. You have to have some blood flow to the brain. You can't live without blood flow. You could have no blood flow, you're gone. 3 hours, good medication. It has its side effects, of course, but you got to get that number two in, which is your clot buster medication. You get that in, or you want to see if you have a number three or four or five or six, even. But the seventh one, the
Is
where
for
you sixth and seventh actually, or more so seventh, where you have to do repair of the vessels, is mostly for your hemorrhagic stroke, the one that you have to get surgery involved. I sometimes they go in and put a clip in the brain. If you have a AV malformation, if you have an artery and a vein that got burst, you can clip it. You can put clips in. It sounds a little bit gruesome. Sorry, I know Maya doesn't like it, but sometimes you have to go in and repair the bleeding. So there's a surgical. So they have completely different treatment. One, you have to open up the vessel. The other one, you have to stop the bleeding. Let's play the video. I think Jeremy has something he wants to show something, and then we can go to the rehab part.
But what have you been on with? What have you been up to?
Yes. But
Yeah? What was that?
I was man.
You alright? Dave? Dave? Dave, listen, I'm just going to go and get someone, alright? Alright, just give me a minute. Okay, 1 minute.
Dave, right, Jason, can we move this table out, please?
Yep.
Yeah. Right, Dave, can you smile for me? Okay, Dave. I need you to try and lift your arms for me. And this one? Right, can you tell me your name, please?
No.
Okay. Jason, can you just stay with me? I'm going to call for an ambulance.
Dave, it's me, alright?
Yes.
Just gone to get an ambulance, alright? Alright, mate, just take it easy.
If you think someone is having a stroke, use the FAST test. Face. Look at their face and ask them to smile. If they're only able to smile on one side of their face, it's probably a stroke. Arms. Ask them to raise both arms. If they're only able to raise one arm, it's probably a stroke. Speech. Ask them to speak. Are they struggling to speak clearly? If they're slurring, it may well be a stroke. Time. If the answer to any of these questions is yes, then you need to call 999 or 112 immediately and ask for an ambulance. Be sure to tell them that you think the casualty is having a stroke. While you're waiting for help, keep the patient comfortable and supported. Monitor breathing, pulse, and responsiveness. And prepare to open the airway or administer CPR if necessary.
I think this video also was emphasizing the same thing, the fast part. So it also was talking about fast, FAST. Is that right? Dr. Awan, what do you think? The next part.
Yes, sir. Actually, rehabilitation therapies are very important because, as we have discussed, that there is damage to the brain cells, and what happens that they will affect the different parts of the body, as we have discussed past. So there will be long-term effects as well. So rehabilitation therapies are very much important for that, for the recovery part. This includes the physical therapy for the body parts, speech therapy, as we have discussed, the S part of the fast, and then occupational therapy, cognitive therapy, and behavioral therapy, because the person will face some difficulties for future. So we have to focus on the rehabilitation therapies as well, so they can carry on with their regular activities uh, as as soon as possible. And lastly, we have the prevention. What should we do to prevent the stroke? As we have already discussed that we have the various risk factors which are very common in our general population. So there are general things which everyone should do, whether on risk of the stroke or not. This includes some making some lifestyle changes, such as eating a healthy diet, maintaining a moderate weight, exercising regularly, and not smoking tobacco and avoiding alcohol or only drinking moderately, and also adding some nutritious diet, like eating nutritious diet means including plenty of fruits, vegetables, whole grains, nuts, seeds, and legumes, and also limit the amount of red and processed meat in the diet, as well as cholesterol and saturated fats, as we already discussed, that plaques will be formed and they will cause the obstruction as a result.
Dr. Wan, that I think was quite a brilliant presentation. We really loved it. And I think all of us appreciate you preparing and doing a fabulous sort of job. I think there is a couple of messages that we want to give to our listeners. First one thing you're going to put up is from the last podcast where for doing such a brilliant job. Um, so well done, Dr. Mariam, for doing a sort of like fabulous job on your blog, I think. So you've been nominated as the winner of it. Next week's topic is going to be on anemia and why is it important. And we're going to do a discussion on that anemia, what's the causes, how to recognize, and what are the treatments. So very important topic. So Dr. Safia is going to be giving us a talk on this. And then for question and assessment that is going on. And the question that we have for this week is on your screen. I think it is, have you looked after or seen a stroke patient? What challenges did you face and how will you adjust your approach this time around that you've listened to the talk? So please put your responses on by April 18. I know Ms. Tyra will be looking for your responses. Please make sure you like and subscribe AMT and the Khan Clinic program. It's very important that you do that so that we can continue providing you with updated information and talks about this. And lastly, I want to just say that I want to just thank my in-studio team for doing just a very splendid job. They've come a long way just in the last few months. Jeremy, Maya, Rida, Zalika, Hamza, Hafsa, Farhana, and all of them, they do quite a smashing job, including Ms. Tyra and Banish. I just want to thank you very much, Dr. Wan. Thank you for coming on board. It was quite brilliant presentation, and thank you everyone else who've done sort of like a marvelous job in participating. We really look back for your feedback, and we want to try to get in as much as good information, robust teaching to you guys. All right, thank you, and have a good weekend. This is Dr. Khan signing off from Khan Clinics, which is powered by American Muslim Today.